Hello, and thank you for joining us for another edition of Premier Research Lab's exclusive podcasts. We are excited to collaborate with Austin's own People's Pharmacy, a community-oriented integrative pharmacy that has been a local favorite for over 40 years. My name's Jenny, and I'm the Brand Education and Content Manager for Premier Research Labs. And today I'd like to welcome Stephanie Chan. She is a functional nutrition inspired compounding pharmacist who works here at People's Pharmacy in North Austin at their compounding facility. Thanks so much for taking the time to join us today. Welcome, Stephanie. Tell us a little bit about yourself.
Yeah, thank you so much for having me today, Jenny. My name is Stephanie, and I am a compounding pharmacist with People's Pharmacy here in Austin. I graduated from University at Buffalo, and I've been practicing for 9 years now. And most recently, I've been with People's for the past 3 years or so.
Great.
I grew up around my dad's community pharmacy in New York City, so I just gravitated towards the mom and pop feel of People's.
Oh, wonderful. Yes.
Yeah.
Wonderful. Well, that answers part of my next question is, what do you love about being a pharmacist and working at People's specifically?
At People's Pharmacy, I have a opportunity as a compounding pharmacist to offer options that balance patient choice and doctor's choice. So, when it comes to medications, it's things like dosage form or any personal preferences or dietary preferences, like if a patient is gluten-free or dairy-free, which we don't often relate that to medications, but
Right.
you'd be surprised to see how much, excipients and things are in there as well. And some people are just very sensitive to those substances. And, we're able to offer patients any variation of a drug that's not already on the market.
Well, that's excellent because excipients are like another silent ingredient that does more harm than we even realize. And so, like you there at the compounding pharmacy, Premier Research Labs also is excipient free, and we kind of consider ourselves a pioneer of excipient free manufacturing. So we are on the same page with just give us the medicine, give us the substance that you think has the beneficial effect, and nothing else, please.
Yeah.
Nothing else that's not food like.
Yeah.
So that's really a relief because we are in a world now where there's more and more people with environmental sensitivities, food sensitivities, chemical sensitivities, and they need safe medicine too.
Exactly.
So, and it's nice to know that you have the ability to remove things that sometimes just come along for the ride.
Yeah. And, not everybody needs that personal touch to their medications, but at least that option is there.
Right. And again, I imagine compliance goes way up because you bothered to care.
Yeah. I would hope so.
I think there's a big part of that.
Yeah.
That's part of the medicine.
Yes.
When you don't feel like an object of your medication protocols.
Yes.
You are the person with the imbalance, and you need allies during that process and not just a
100%.
task list and fear.
Yes.
So anyway, I know that's what you all offer there. Well, we thank you for taking the time out of your busy schedule. Today's topic is a pretty exciting one and important to cover, although it could be a bit complex. So we're just going to scratch the surface. But today's topic we call the give and take of medications and nutrients, what you need to know. More than 50% of people in the U.S., adults, are struggling with cardiovascular risk factors and are often given cholesterol-lowering medication as an intervention. And one of the most common ones are statins. And statin medications are effective at what they do, but it proposes some unique challenges. And I wanted just to first have a pause and get you to explain to us and our listeners what is medication-induced nutrient depletion, and is it something we should be concerned about?
Yeah. So just through taking medications and through our bodies trying to absorb and use the medications that we're taking, it can disrupt how we digest, absorb, and use nutrients in the process. So unfortunately, it happens to some medications more than others. But what we're seeing is that patients who are on multiple medications, they're actually at a higher risk for nutrient deficiencies. And, a lot of times these nutrients are found in common foods that we're eating, but unfortunately, it's not present in sufficient levels or in a form that we can readily absorb. As a
Mm.
pharmacist, it's actually our job to look at the appropriateness of patients' medications in terms of, correct dosage, safety, drug interactions, and potential risks associated with medication use. And as a pharmacist, we actually have the opportunity to talk to patients about nutrient depletions.
That puts you all in a very unique position as a patient advocate that is desperately needed. I find also that it could put you in a position where there might be a window of opportunity to consider what nutrients through food or lifestyle changes could be addressed, or if that's not the case and medication is needed, just to prepare them with the information of what might come along for the ride in terms of discomforts or changes in your day-to-day energy, quality of life, etc. Um, so, given the medications of statins, do you mind telling us a little bit about how they work and how it relates to CoQ10? That seems to be a common connection that statins can cause a depletion in CoQ10 or just lower blood levels available.
Yeah, so statins is one of the most commonly prescribed medications in the US and probably among the world for its cholesterol lowering effects. But as a result, what we're seeing is that levels of CoQ10 are actually much lower. I think almost some studies are saying up to like 54%
Hmm.
lower in certain cells in our blood and muscle tissue when you're on a statin versus when you're not. And CoQ10 is a powerful antioxidant that plays a role in energy production for every
Mm.
cell, right? So
Yes.
a CoQ10 deficiency can show up as in things like and present itself in like high blood pressure, cardiomyopathy, fatigue, certainly, and a decreased immune function, and even maybe a decrease in cognitive function. So many people on statins complain of feeling some muscle aches and pains,
Oh,
and now we're
interesting.
yeah, and now we're seeing that people who are complaining of these symptoms tend to have lower levels of CoQ10.
Interesting. I also saw that the research they say is a bit inconclusive, but when CoQ10 was administered at maybe 100 milligrams a day, they saw that some of the experiences of those adverse effects were diminished to some degree. So that's, even though there's still more need for more studies, it's just something to consider in terms of extreme fatigue, or if your quality of life changes to a point where you're like, these medications might be helping my biomarkers, but they're
Yeah,
not helping my quality of life, or
exactly.
my, how can you have the best of both?
Yeah, and I think that's so important that you touched upon. Biomarkers are important, but I think the symptoms that patients are presenting with, yeah, you're not treating numbers. We're trying to treat the person and the
Hmm. That
patient.
is so good to hear still. Thank you. See, and I think that's also what integrative pharmacy is about. It seems to be blending the best of all these disciplines as we have growing populations of people using medications and botanicals and teas
Yeah,
and supplements. So there's a need for more education all the way around, but and to be able to intervene when
yeah,
when it's when it's okay to do
yeah.
so.
Yeah, a lot of times, we do have, and I guess I could speak for myself. I don't know about other pharmacists out there, but more and more studies are showing that if elevated cholesterol is the only, biomarker per se that is elevated, and the patient doesn't have any history of diabetes, high blood pressure, or any other cardiovascular risks, then is, do we need to put them on a statin? I think that's a wonderful conversation to have with patients when they're treatment naive, they're coming in for their
Mm,
first prescription.
yes.
Discuss alternatives, simple lifestyle changes, especially with cholesterol, when you're going in for just one test, during your annual checkup, right? You're
Right. It's
seeing
a
it.
lot to hang your hat on
Yeah,
in
it's
terms
it's
of,
a snapshot in time that
mm,
we're looking at versus, and we know that if you had, red meat for a couple of meals leading up to that blood test, your levels are probably going to be a little bit elevated versus if you ate really well before
right.
your annual
You,
checkup.
you did your I'm going to the doctor
Yes.
diet. Yes.
Exactly.
Well, those are all really good points. And again, with the rise in metabolic syndrome and cardiovascular, like it feels like it's all about the risk factors. And the more we know about the red flags, we can address it sooner through counseling and education before the medication has to come, if that's possible.
Yeah,
Again, some circumstances are pretty extreme,
for sure.
but
Yeah. And I wish like people kind of realize that a little bit more. Like pharmacists are the most accessible healthcare
yes,
practitioners. And depending on where you go and which pharmacy you go to,
correct.
usually the pharmacist is more than happy to take a few minutes to talk to you about options. So never feel like you're bothering them by asking questions and asking, like, is this medication necessary? What are some alternatives? Because most of the time, I could speak for myself, I'm more than happy to share some alternatives with them.
Absolutely, and I did witness that as being a customer at People's Pharmacy, and just the integrative feel and the high quality products that you have available. So it does feel like a safe place for fearful or curious customers,
Yeah.
patients,
Yeah.
pets.
Yeah, and we do pride ourselves in the line of supplements that we choose to carry. We have a whole wellness team who is so well versed in the alternative therapies. And of course, the pharmacist there, right there to collaborate with them so that we're checking for potential drug interactions and things like that.
Right. It's nice to be reminded that your ally may not be as far away as you think. And if your doctor is hard to get a hold of, don't forget about integrative pharmacies like People's.
Yes.
It is a People's kind of place.
Yes.
It's a good place to be. Let's see here. Would you say that some of the challenges are the standard treatment protocols just being given without pause, just because of this sense of urgency and day-to-day wellness checks?
Yeah, for sure. And I think because a lot of times in allopathic medicine, like doctors and providers are looking at, if you're presenting with this diagnosis of like high blood pressure, these are the first line, second line therapies, and that's just what's given to the patients. And, unfortunately, many times patients leave the doctor's office not even knowing what their medication is for,
Right.
how to take it and all that. And it is up to the pharmacist to discuss that with them for sure. Yeah, so when it comes to drug induced nutrient depletions, we can and it should be discussed as part of our counseling because
Mm.
we always discuss the potential side effects that occur. And of
Right.
course, in the case of statins, we know that studies are pointing it may be due to a decrease in something like CoQ10. So it's really easy for us to kind of put that in there during our counsel session with them to, remember to, get a supplement or make sure focusing
Exactly.
on foods that have it.
And just another aside is that in general, this is another scenario where something like cholesterol is grouped, given it like just a bad rap all the way around, when we actually need healthy amounts of cholesterol for sex hormones and other kinds of things in our body. That if we shut that synthesis down, I think even one of the side effects of statins was impotence, or, it's like, wait a minute, there's too many things that are connected, and to choose one over the other without fully knowing or being prepared about how you can like do the dance of medication therapy, because it has to happen in many cases, but there's ways to improve your quality of life by filling the gaps with dietary supplements and good diet choices and lifestyle. And so
Absolutely.
anyway,
Yeah.
little get
No.
on the high horse there.
Yeah,
Sorry about that.
no.
I think we're speaking the same language for
Yes,
sure.
100%.
And it again, it's exciting to know that you are among like-minded physicians and pharmacists rather at People's, that are there to help people with some very complicated situations and offer an ear and more in terms of
Yeah.
options and information.
And a lot of times it is, it's just also kind of like reassuring patients as well. Because anytime you're leaving the office and like some biomarker is off, there is that fear that comes with it,
Absolutely.
like that what if, like, or, at least the people who are paying attention to their health, they just think, oh, I have high cholesterol. I'm at risk automatically for heart disease. And I don't think that's necessarily the case. So the pharmacists are always there to kind of lend that ear and give them like a full explanation of what's really
Right.
going on.
Yes, especially as the urgency
Yeah.
potentially in terms of like how many annual visits has this been discussed or
Yeah.
brought up? Is it just the first one? And it's like,
Mm-hmm.
hey, how much butter are you having these
Yeah.
days? That kind of thing.
Yeah.
But anyhow, it's always an opportunity to check in with people's questions
For
for
sure.
sure. I feel like with that kind of keen discernment and advice, you're likely to stay on your medication more.
Yeah.
If somebody is able to tell you, this might happen if you start to feel this in a
Yeah.
couple of weeks, then you might want to come back and we'll get you some CoQ10
Yeah.
or whatever, if that's the case. It's like give them a chance to have that experience, because we're all snowflakes. I
Yes.
call it the snowflake effect. You can say it's one pill for X milligrams for everybody, but we're all different.
Yes.
So to have the opportunity, again, physicians can be hard to get a hold of, but you're a local pharmacist. And once you have that experience and that comfort established, you can pop in and ask or say,
Yeah.
hey, you counseled me about this a couple of weeks ago, and I'm experiencing 3 out of the 10 things you said I
Yeah.
might. So what do I do next?
Yeah.
I can't get in with my doctor if that's the case, but I feel like, again, you guys are underutilized allies.
Yes, 100%. And when you say, again, we are our own, like, nobody's going to advocate for our health like ourselves.
Right.
But when it comes to something like in a subject that you're so unfamiliar with,
Right. And there's fear
yeah,
involved too.
there's fear. And one thing I want people to know is that, like, if you're not responding well to one medication, trust me when I say there are so many other options out there for you. And it's not on you to, come up and do the research yourself. That is why the pharmacist is there. We are calling doctors' offices all the time, and we're there to advocate for the patients if something is not working for them.
Right.
And if the doctor's not familiar with the alternatives, that's again our job. We could present them with alternatives that that work.
I feel like CEUs, there aren't enough of them that are maybe nutrition oriented.
Yeah.
For physicians, and hopefully, we can all change that. That's the future, is like the best of both. How
Yes.
can we blend what we need to do from a allopathic perspective with what gaps might happen as a result?
Yes.
So.
Absolutely. And I think that's one thing that I love so much about compounding is that we have that flexibility of, if, and this goes for like pet medications too. I know that could be like a whole separate conversation, but
they can't say yuck.
Yeah.
Oh, yes, they can. Actually, yes,
yes,
they can.
they really can. But, again, it is really comes down to patient choice and preference and like what they're able, like what's comfortable for them in terms of like maybe dosage form. But that's why we're there. Like if a kiddo can't take tablets or capsules, we're more than happy. Or a lot of times if they're sensitive to a certain color of a liquid,
right.
For a lot of kiddos because of like the
food sensitivities, chemical sensitivities.
Yep.
We are in another world of what have we done?
Yeah.
Sensitivities.
So I love that we advocate and we are able to reach out to the doctor's office. And maybe it's because they're talking to another professional, but they know that,
Right.
what we're recommending is actually like on par and
Exactly. And I feel
aligns
like
with
you
what they're
can talk
doing.
their language and
Yes.
you have the evidence and
Yeah.
you know how to scan the evidence as to whether it meets their own criteria, everyone's criteria.
Yeah.
So it's on our side of the fence here. We celebrate any and every study to some extent because we know we're moving forward, but you still have to have that eagle eye perspective saying more evidence is needed because of the conditions that are being treated and the consequences. We're not ready to um, make such big choices without more safety profiles.
Yeah.
And then that goes to my earlier question. You said that one of the most important things in your eyes about dietary supplements was quality.
Mm-hmm.
There's evidence, there's quality, there's herb drug nutrient interactions, but quality is what you said mattered most to you. Do you want to say anything more about that?
Yes. So supplements, the world of supplements, it's not regulated by the FDA.
It is, but poorly.
Yeah.
Okay.
So it's
We said it. It's true. So many people say it's not regulated, but it really is.
okay.
There's the
You might
Dietary
have to tell
Supplement
me.
Health
Yeah, you might
Education
have
Act.
to tell me
Yes,
more
I will
about
put
that.
my nerd hat on, but it's just poorly done.
Yeah.
There's not enough people to call out the people that are not doing it well or
Yeah.
ethically or safely because food as medicine should be an option and that can
Mhm.
come through botanical supplements. And so
Yeah.
anyway, go ahead.
For-
Sorry.
yeah,
Back
so-
to quality and your comments.
To me, like quality is one of the biggest things because, again, because of the poor regulation, a lot of times there are extra fillers in products.
Yes.
Some products could be sitting on shelves for years without being touched, and there's really no regulation in part of in that per se. Um, so I always advise, especially the people who come through our doors, getting one of the products off our shelves at People's is going to be very different than the, 300 count fish oil from Costco.
Absolutely. Yes, yes. Yes, absolutely. You're right.
Yeah.
There is a cost to quality and also a safety net that is cast when you're at a place like People's because you're not in there if you're not GMP compliant
Yeah.
and vetted for safety and purity and good quality ingredients. And that's what I respect a lot about Premier Research Labs, just as an aside, is that we do have excellent attention to quality and
we love that.
Yes, absolutely. And innovation we have
Yeah.
a lot to offer, but I do appreciate your expertise and your passion for being out there blending the best
Yeah.
of what you have to offer.
And to add on to that, I think it's important to note, while we love using supplements as like adjunctive therapy, it's not. I think it's important to note, it is important to check that there is no herb drug interaction.
Yes,
so
correct.
if you are on some set of medications and you constantly see some ad on some, weight loss herb that is all the hype, make sure you're just checking with your pharmacist for any potential drug supplement interactions because those do exist and can be a big deal.
Right. I feel like sometimes, depending on how long you're on a medication, you kind of forget.
Yeah.
You're like, oh, yeah, that's been my standard for 10 years. And then you bring something else in the mix and don't realize that you might be creating unexpected occurrences.
Exactly.
Sometimes good, sometimes not. Mostly not good.
Yeah.
But again, another plug for pharmacists as ally.
Yes.
So thank you for that.
For sure.
For those people listening that are unfamiliar with People's Pharmacy, what would you like to tell them about what it has to offer and how it's unique?
People's Pharmacy has been a local favorite for over 40 years. We are wellness, we are pharmacy, and we are compounding specialists committed to empowering people to make educated, healthy choices every day.
Yes.
People's offers an impressive variety of the highest quality and unique wellness products and local gluten-free grab-and-go foods.
Delicious. It is.
You have to try it out
It
if
is.
you haven't already.
And your smoothies, all the juices.
Yes.
It's wonderful.
You're always greeted at the door by our knowledgeable wellness specialists and pharmacists to help guide you on your wellness journey to achieve optimal health. make sure you check us out at peoplesrx.com. And
It's like you're our wellness headquarters,
exactly.
especially for an integrative touch and a personalized touch.
Exactly. And we've been going by Keeping Austin Well since 1980.
Absolutely. Don't stop. Thanks again for your time, Stephanie.
Thank you.
And again, for your listeners out there, please follow us on our social media channels, and you can access podcast-related resources and a quick link to People's Pharmacy. Have a great day. Thank you.
Good job. That's a wrap.
All right, that's it.
Otherwise, we're going to keep talking.